The doors of Meridian Valley Medical Center in Creston, Colorado, burst open at 11:47 p.m. on a Tuesday, and the man who came through them was dying in ways that most people in that building had never seen before. He was in tactical gear, half of it shredded, and the blood coming from his left side wasn't pooling, it was pulsing. A military transport driver and two civilian paramedics were holding him together with their bare hands and a pressure bandage that had already soaked through twice. Lieutenant Dale Harwick of the Creston Police Department got there first. He planted himself in the center of the trauma bay doorway like he owned the deed to it. The nurse who reached the gurney 2 seconds later was small, wore no makeup, and had her dark hair pulled back in a way that said she hadn't thought about it since morning. Her name badge said Nora Voss, RN. She was already snapping gloves on when Harwick's forearm caught her across the chest. "You're just a nurse," he said. "Step back." She looked at the wound. She looked at the man's face. The dying soldier's lips moved, barely, but she heard it. He said her old call sign, the one that had been classified for 6 years. If this story already has your pulse running, you're in the right place. Subscribe to this channel, hit like, and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story travels. Now let's get into it. Nora Voss had worked the night shift at Meridian Valley for 3 years, and in that time she had become the kind of person that institutions produce without meaning to. Someone essential who gets treated like furniture. She knew where every crash cart was. She knew which attending had shaky hands after hour 10, and which resident panicked when a pressure reading dropped fast. She knew the supply room had 2 broken locks, and that the backup defibrillator on the 2nd floor needed its battery replaced. She had submitted that maintenance request 4 times. Nobody had fixed it. She wasn't unpopular exactly. She was just unremarkable to the people who decided what remarkable meant. The charge nurse, Deborah Holt, occasionally complimented her efficiency the way you'd compliment a dishwasher for getting the glasses clean. The attendings who worked trauma, Dr. Philip Sato, Dr. Camille Oduya, treated her with professional courtesy that had no warmth in it. They gave orders, she executed them, and that was the arrangement. She had been in Creston for 3 years. Before that, there was a gap in her employment history that she never explained, and that no one had ever pressed her on, because she was competent and quiet and showed up on time, and that was enough. The soldier's name was Sergeant First Class Marcus Teal, though Nora didn't know that yet when she pressed her palm flat against the saturated bandage at his side and felt the specific wrongness of the wound, the location, the depth, the way his breathing had developed a particular catch that meant one thing and one thing only. "He's got a hemothorax developing on the left," she said, to no one in particular, because in that moment she wasn't thinking about the room. She was thinking about the injury. "He needs a chest tube now before—" I said step back. Harwick's hand closed around her upper arm. She turned and looked at him with an expression that wasn't anger and wasn't fear. It was something more unsettling than either. The look of someone doing a rapid calculation and coming up with an answer they weren't going to share. "Lieutenant, that man is bleeding into his chest cavity. If you keep me from—" "Dr. Sato." Harwick raised his voice without releasing her arm. "Can you get your staff under control?" Philip Sato was 44 years old, board-certified in emergency medicine, and deeply uncomfortable with conflict. He looked at Nora. He looked at Harwick. He made the choice that people in institutions so often make when the choice is between what's right and what's easy. "Nora," he said carefully, "let's give the team room to work." "The team isn't seeing what I'm seeing." "Nora." She looked at Sato for a long moment. Then she looked at the soldier on the gurney. His lips had stopped moving, but his eyes were still open, fixed on the ceiling with the specific exhausted focus of someone who was still choosing to stay. She let Harwick walk her back. She didn't fight it. She stood near the doorway, arms crossed, watching. Sato moved to the gurney with the trauma resident, Dr. Kyle Bren, and 2 other nurses, Heather Paz and James Torricelli, flanking. The paramedics gave their handoff report. Vitals, GCS, estimated blood loss, time of injury unknown. Nora listened. She watched Bren's hands as he started the assessment. She watched the monitor readings. Harwick stood nearby with his arms folded and his jaw set, radiating the particular smugness of a man who had gotten what he wanted and felt that getting it had proved something. "You always have trouble with your staff?" he asked Sato conversationally. Sato didn't answer. Nora said nothing. She was watching the monitor. The oxygen saturation was 91 and dropping. A sad... Dale Harwick had been with the Creston Police Department for 19 years. He had made lieutenant 8 years ago and had operated since then with the confidence of a man who had never once been seriously questioned by anyone in a position to do anything about it. He had authority in Creston. Not just the legal kind, the social kind. He knew the hospital administrators. He knew the city council members. He had a relationship with the local paper that he had carefully cultivated over many years, and that relationship had been useful more than once. He had come to Meridian Valley tonight because the military transport had come through his jurisdiction, and he wanted to know what was on it. That was the reason, he told himself. The fuller version was that he didn't like things happening in his city without his knowledge, and a military vehicle running hot through the east side of Creston at 11:30 at night qualified as something. He had gotten to the ER before anyone thought to call administration, and he had planted himself in that trauma bay with the confidence of someone who had been doing things like that for 19 years and had never paid a price for it. The nurse, Voss, her badge said, had come at the gurney fast. Too fast for someone who was just supposed to be managing an intake. He'd noticed that before he'd noticed anything else. He'd stopped her because that's what he did when something moved too fast around him. He stopped it. He was watching Sato's team work now, and he was starting to feel in the back of his mind the small, specific discomfort of a man who has made a decision he can't quite defend. Not because he'd done something genuinely wrong, but because the math wasn't adding up the way he'd expected. The patient's numbers were going the wrong direction. Bren called out a pressure. Sato responded. One of the nurses hung a second bag of saline. Someone called for blood type and cross. Sat's at 89, Heather Paz said, and her voice had gone tight. Nora hadn't moved from the doorway. She was watching the monitor like it was the only thing in the room. What? The crash happened at 12:03 a.m. It wasn't dramatic the way crashes look on television. The monitor alarm didn't wail. It gave 3 short beeps and then went to a continuous tone, and Bren said, "I've lost his pulse," in the voice of someone who had trained for this moment but was feeling the gap between training and reality close around him fast. Sato called for compressions. Bren started them. Paz was pushing medications. Torricelli was on the phone to the blood bank. Nora crossed the room. She didn't ask permission. She didn't look at Harwick. She went to the left side of the gurney, assessed the chest, and said to Sato in a completely flat voice, "You have a tension pneumothorax converting from the hemothorax. He needs needle decompression right now and then a chest tube. If you start a second round of epi before you release that pressure, you're going to lose him." Sato stared at her. Philip. Not Dr. Sato, just his name. Right now. There was a half second, the kind of half second that determines outcomes, where Sato could have told her to get out again, where his ego or his discomfort or his deference to the man behind her could have made the call. He picked up the needle. He decompressed. The monitor alarm changed pitch. Not fixed, but changed. The continuous tone broke into irregular beats. "Chest tube," Nora said. "I'll walk you through the placement." "I know how to place a chest tube." "I know you do. I'm saying the angle on this one is going to be off because of the way the blood has shifted. You're going to want to go more posterior than you think." Sato looked at her for one more second. Then he said, "Get me the kit." Harwick took a step toward the gurney and then stopped, because the energy in that room had changed in a way that he didn't fully understand but could feel. The nurses and the resident had reorganized themselves around Nora without anyone announcing it. She wasn't touching the patient. She wasn't doing anything that would give him a clear reason to pull her back out. She was just there, and everything in the room was oriented toward her. The chest tube went in. Sato swore quietly when he felt the resistance and adjusted the angle exactly the way Nora had said. Dark blood drained into the collection chamber. The monitor started showing something more like a rhythm. "He's got a pulse," Bren said. Nobody celebrated. Nora was already moving down the gurney, checking his legs, checking his left arm, finding something at the wrist she didn't like. "He's also got compartment syndrome developing in the left forearm," she said. "It's early. We have a window." "How did you—" Bren started. "The color, the tension in the tissue. Somebody needs to call orthopedics." Torricelli was already on the phone. Harwick had not moved. He was standing slightly outside the organized chaos of the trauma bay. And for the first time in a long time, he was in a room where his presence made no difference to anything. He didn't like the feeling. "Who authorized her to return to this patient?" he said, loud enough to be heard. Nobody answered him. "I'm asking a question." Louder. Nora turned just briefly and looked at him with an expression that was almost gentle, like she was looking at something she recognized. "You can file a complaint with administration in the morning, Lieutenant," she said. "Right now I need everyone in this room focused." She turned back to the patient. Harwick's jaw worked. He pulled out his phone. At 12:31 a.m., Marcus Teal was stable enough to move to the surgical suite for a procedure on the forearm that the orthopedic attending, Dr. Renata Kwan, who had arrived looking irritated about the hour, and then looked at the forearm and stopped looking irritated, described afterward as caught exactly when it needed to be caught. Nora had stayed through stabilization and then stepped back the moment the transport team arrived to move him. She'd stripped her gloves. She'd updated the chart. She'd gone to wash her hands at the sink in the corner. That was when Harwick found her. He came in with the charge nurse, Deborah Holt, who was wearing the expression of someone who had been woken up by a phone call and had not had enough time to prepare herself for whatever was happening. "Nora," Deborah said, and the way she said it conveyed a full paragraph of information about whose side she was on. "I'm documenting the handoff," Nora said. "You need to come with me," Deborah said. "I'll come with you when I'm done with the documentation." "Nora." Harwick stepped forward. "I've spoken to Dr. Graham." Marcus Graham was the hospital's chief of staff, a bureaucrat who had gotten the job by never making enemies, which meant he'd also never made any hard decisions. "He's asked that you be removed from patient care pending a review of tonight's conduct." Nora looked at the screen. She finished what she was typing. She hit save. "Tonight's conduct," she said. "You were asked to leave a trauma bay and you returned without authorization. That's a protocol violation." The patient coded. "Protocol violations don't become acceptable because you believe the situation warranted them." She turned from the screen and looked at him with that same quality of attention she'd given the monitor earlier, calm and total and directed. "The patient is alive," she said. "That's not the point." "It's the only point, Lieutenant." Harwick pulled himself up. 19 years of authority straightened his spine and squared his shoulders. "You're going to find that this hospital takes the conduct of its staff seriously, Ms. Voss, particularly when that conduct involves defying direct instructions from law enforcement. You're not law enforcement in a trauma bay. You're a visitor." The silence that followed was the kind that has texture. Deborah Holt cleared her throat. "Nora, please, just come with me. This can all be sorted out in the morning through the proper—" "She's suspended," Harwick said. "Pending review. I want her out of this building." Deborah looked at the floor, then at Nora. Nora took her badge off the lanyard. She set it on the counter. She picked up her jacket from the hook by the door. "I'll need a copy of the incident report," she said, "for my records." "That can be requested through HR," Deborah said, not meeting her eyes. Nora nodded once. She walked to the door. She stopped. "The patient in surgical suite 2 has a history of adverse reactions to cephalosporins," she said. "It's in his chart, but someone should flag it for Dr. Kwan before she closes." She paused. "Just in case." She walked out. The parking lot of Meridian Valley Medical Center at 12:55 a.m. was cold in the specific way that Colorado nights get cold in early November, which is the kind of cold that has weight to it. Nora sat in her car with the engine off for 6 minutes. She wasn't crying. She wasn't calling anyone. She was looking at the steering wheel the way she'd looked at the monitor earlier, taking something in, processing it, coming to a conclusion that she kept to herself. Her phone had 3 unread texts from a number she didn't recognize. Not unusual. Spam, probably, or a patient's family member who had gotten her number from somewhere they shouldn't have. She opened the first one. "We know where you are." She didn't react. "Second, he asked for you specifically. We'll be there in 22 minutes. Third, sent 7 minutes ago, Sergeant Teal said to tell you, Nightfall sends her regards." Nora read that 3 times. Nightfall. She had not heard that name in 6 years. She had not expected to hear it again. It belonged to a different life, to a version of herself that had been, as far as the official record was concerned, quietly filed away and forgotten. She looked up at the hospital building. The sound reached her before the lights did. Rotors. More than one aircraft. The specific deep pulse of military helicopters flying low and fast, which she recognized the way some people recognize the sound of their own heartbeat. She got out of the car. 3 vehicles came through the main gate of Meridian Valley at 1:04 a.m. 2 were black SUVs with government plates. The third was a military transport, larger than the one that had brought Teal in, and it moved with the particular authority of something that has already decided it doesn't need anyone's permission. 2 helicopters were down in the far parking lot, which the hospital had not authorized, and which no one had thought to try to stop. Inside the ER, Dr. Sato was in the middle of explaining, to a man in a uniform he didn't recognize, that Sergeant Teal was currently in surgery and not available for visitors. The man in the uniform, tall, late 50s, the kind of bearing that didn't come from a gym, looked at him with the patience of someone who has spent years being politely told things that weren't true. "I'm not a visitor," the man said. His name tag read Brig, Generos Warren Cole. "I want to speak to this nurse who ran his trauma stabilization, Voss. Nora Voss." Sato blinked. There was an incident. She's no longer in the building." Cole looked at the man beside him, a younger officer with a tablet. The younger officer said something quietly. Cole looked back at Sato. "She's in the parking lot," Cole said. It wasn't a question. He turned and walked toward the exit. Sato stood in the middle of the ER with the very specific feeling of someone who is beginning to understand that they have made a serious miscalculation about a situation they thought they had completely correct. Nora was leaning against her car when Cole came through the exterior doors. He stopped 3 feet from her, and the two of them looked at each other in the sodium light of the parking lot, with the helicopters still ticking down behind the tree line. "You're late," she said. "Traffic was bad in the Hindu Kush," he said. "You look terrible." "Surgical suite 2, second floor. He's in with Dr. Kwan. Left forearm compartment syndrome, hemothorax resolved, pneumothorax decompressed. He'll keep the arm if Kwan doesn't miss anything, and she won't. He told us to find you." "I heard." "He said Nightfall." She looked away at the mountains, which were invisible in the dark but present. "That name doesn't exist anymore," she said. "It does tonight." Cole let a moment go. "What happened in there?" She told him. Flat, precise, in the order it happened. No editorializing, no tone. The way she used to give after-action reports in a very different setting, to a very different commanding officer, under very different circumstances. Cole listened. He didn't interrupt. When she finished, he said, "The Lieutenant, Harwick. Dale Harwick, Creston PD, 19-year veteran, from what I could find. You ran him in the 6 minutes you were sitting in your car." "I was thorough." Cole almost smiled. Almost. "He suspended you." "He recommended suspension. The chief of staff signed off. And then he had you escorted out." "He didn't have to escalate that far," Nora said. "I went." Cole looked at the building. He looked at his watch. "We have a problem," he said. "Tell me something I don't know." Marcus Teal is not just any sergeant. He's carrying information that a certain number of people would very much prefer didn't exist. The people who tried to ensure it didn't exist tonight, they're going to try again. And the next time, the setting might not be a hospital with a full surgical team. Nora absorbed this without visible reaction. "He's going to need round-the-clock protection," she said. "Yes. And you need someone who can manage his medical recovery and also understand what that protection requires." "Yes." "You're asking me to come back in." Cole didn't answer right away. He looked at her with something that might have been apology, in a man who wasn't built for apologies. "I'm asking if you're willing," he said. "That's a different question." Inside the hospital, through the glass doors, she could see Harwick. He was talking to someone on his phone, gesturing at the black SUVs in the lot, with the agitation of a man who has just realized that the situation he thought he controlled has developed features he didn't plan for. As she watched, he looked up and saw her. He saw the man standing next to her. He saw the uniform and the rank, and the 2 officers flanking Cole like they were part of the architecture. The phone call ended. Harwick stood very still. Nora watched him process it. She watched him start to understand something about the last 2 hours, and she watched that understanding arrive on his face the way a wrong answer arrives on a math test. Not all at once, but building, with a specific dawning dread. "I'll need my badge back," she said. "We'll get you more than your badge." "I don't want more than my badge. I want the one they took tonight." Cole looked at her for a moment. "All right," he said. He turned and said something to one of his officers. The officer moved toward the entrance. Harwick, inside, watched the officer approach and took one small step backward. It was the first step he'd taken backward in 19 years, and from the way he moved, it didn't come naturally. Nora watched it happen, and she felt nothing triumphant about it, just the specific cold clarity of something unfinished beginning to move toward its ending. Her phone buzzed. She looked at it. It was the number from before. 3 words. "We see you." She looked up at the hospital building, at the windows, at the roofline. Not Cole's people. A different kind of watching. She slid the phone into her pocket and said, "We need to move Teal as soon as Quan clears him for transport." Agreed. "And we need to pull the OR security footage from the last 2 hours." Cole looked at her sideways. "You think someone got inside?" "I think Teal didn't end up in my ER by accident," she said, "and I think whoever sent that convoy to Creston knows exactly where he is right now." She turned and walked toward the entrance. Behind her, Cole stood in the parking lot for 3 seconds longer than he needed to. Something had settled in his expression. Not surprise, not relief, but something closer to the acknowledgement a man makes when the asset he never should have let go turns out to be exactly as good as he remembered. He followed her in. At the entrance, she passed the security desk where her badge had been deposited. The officer Cole had sent was already there. The guard behind the desk, a young man named Frisco who had always been kind to her, looked at the officer, looked at Nora, looked at the badge, and slid it across the counter without being asked. She clipped it back on. She kept walking. Harwick was at the far end of the lobby. He had put his phone away and was very still, watching her move through the building she had been escorted out of 40 minutes ago, watching her move through it now flanked by federal officers, in the company of a brigadier general, with her badge back on her chest. She didn't look at him. She had a patient to get back to. The surgical suite was on the 2nd floor, and as she rounded the corner to the stairwell, her badge reader activated the door with the specific electronic click that meant access granted, and she pushed through without breaking stride, and behind her the door swung shut. In OR Suite 2, Dr. Renata Quan was closing the forearm incision with the focus of someone who has been told, 3 minutes ago, by a federal officer, that the surgery they're completing is connected to a matter of national security, and who has responded to that information by completing the surgery with even more precision than they'd started with. The anesthesiologist looked up when Nora entered. "He's stable," she said. "Vitals have been solid for 20 minutes. The cephalosporin flag was in the chart. I saw it. We used vancomycin." Nora nodded. She stood at the foot of the table and looked at Marcus Teal's face. The machinery of the OR breathed around him. His chest rose and fell in the steady artificial rhythm of a man who had come very close to not making it and had made it anyway. She thought about the call sign he'd used. Nightfall. She hadn't been Nightfall in 6 years. She had put that name down the way you put down a weapon, deliberately, with intention, knowing you were making a permanent decision. She had come to Creston. She had taken the night shift. She had submitted maintenance requests for a broken defibrillator and been ignored, and she had shown up anyway, every night, because the work needed doing and she knew how to do it. The badge on her chest said Nora Voss, RN. The man on the table had said her other name, and now there was someone watching the hospital roofline. The monitor above the table kept its steady rhythm. Quan made her last suture. Nora pulled out her phone under the edge of the supply cart, so the camera in the corner couldn't catch the screen. She typed a message to Cole's number. "Check the northeast stairwell. There's a camera in that corridor that's been offline for 6 days. I submitted the repair request. It never got fixed." She waited. 30 seconds. Then, "Confirmed. We have eyes on it now." Then 5 seconds later, "There was someone there." She put the phone away. Quan stepped back from the table and stripped her gloves. "He'll be in recovery for 2 hours minimum. I want a neuro consult before he's moved." "I'll be here," Nora said. Quan looked at her, looked at the badge, looked at the officer visible through the OR window. "What is this case?" she asked. Nora looked at Teal. "Just a patient," she said, "who needs to make it through the night." Quan left. The anesthesiologist began reducing sedation protocols. The machinery kept breathing, and in the parking lot below, Dale Harwick sat in his police cruiser with his engine running and his hands on the wheel, making a phone call that would be the worst decision of his life, to a number that had already been flagged by 3 separate federal agencies. Dale Harwick made the call at 1:22 a.m., sitting in his cruiser with the heater running and the hospital lit up behind him like an accusation. He called a man named Boyle. Not his supervisor, not dispatch. Boyle. The name didn't appear in any department directory, but Harwick had the number memorized the way you memorize a number you're not supposed to write down. It rang 4 times. "We have a problem," Harwick said, when the line connected. The voice on the other end was flat and careful. "Define problem." "The sergeant made it. He's in surgery." Harwick watched one of Cole's officers pace the entrance, talking into a radio. "And they brought her back in." Silence. "Voss," Harwick said. "The nurse. There are federal people here, Boyle, a general, black vehicles, the whole thing." More silence. Then, "How long ago did she go back inside?" 30 minutes, maybe 35. "And the sergeant? Which floor?" Harwick's hands tightened on the wheel. He hadn't thought about the shape of the question until it came out of Boyle's mouth, and now he was thinking about it very hard. "Why does that matter?" "Which floor, Dale?" "Second, surgical suite 2. The call ended. Harwick sat there for 11 seconds. Then he put the cruiser in gear and drove out of the lot, because staying felt worse than leaving, and because Dale Harwick had spent 19 years making decisions in the half-second window before he could think them all the way through. He was 8 blocks away when the first federal SUV pulled across the hospital's east exit. He didn't see it, but the camera on the corner of Meridian Valley's east facade, the one that had been working all along, caught his plates clearly as he left. Cole had the footage on his tablet by 1:48 a.m. He watched Harwick's call log reconstruction, not the content yet, that would take warrants and time, but the tower data, the duration, the recipient's flag number, which 2 analysts in a building 700 miles away had already cross-referenced against 3 open federal investigations, and come back with a result that made the younger officer next to Cole go very still. Cole showed Nora the screen without commentary. She was standing in the recovery corridor outside OR Suite 2, coffee going cold in her hand. She looked at the number. She looked at the flag notation. "Boyle," she said. "You know the name?" "I know the file. It was tangential to something I worked in year 3. Supply chain irregularities in forward operating bases. It never closed cleanly." She handed the coffee back. "Harwick's connected to that?" "Apparently. That's not a beat cop's orbit." "No," Cole said. "It's not." She looked at the OR door. "Teal knew something about that supply chain." "We believe so. That's why they wanted him dead tonight. Not the wound. The wound was the method. They steered the transport to a civilian ER in a mid-sized city at midnight because they thought it would get lost. And instead it got you." She didn't answer that. She was already working through the next part of it, and he could see it on her face. Not panic, not urgency exactly, but the focused forward motion of someone who is trained to think past the present complication to the one that comes after. "The camera in the northeast stairwell," she said. "Whoever was there, and did they get eyes on his room?" "We think so." "Then they know the layout. They know the access points." She looked at the recovery ward door. "We need to move him sooner than Quan wants." She said 2 hours minimum. I know what she said. I'm saying the timeline has changed. Nora was already walking. "Get me Quan." Oh, Dr. Renata Quan was not someone who revised her medical recommendations under institutional pressure, and she was not someone who revised them easily under any other kind. She listened to what Cole's officer told her in the hallway outside the recovery ward, and then she listened to what Nora told her directly, and she stood with her arms crossed and her face doing the math. "His pressure has been stable for 40 minutes, Quan said. "But that doesn't mean he's ready for transport. If something goes wrong in an unsecured environment, something's already wrong in this environment," Nora said. "I'd rather manage his pressure in a military medical unit than explain to you why we didn't move him when we had the chance. You're asking me to accept a medical risk based on a security assessment I can't verify. I'm asking you to look at what just walked into this hospital and decide how much you trust that I'm telling you the truth." Quan looked at Cole, at the 2 officers behind him, at the fact that there were now 4 armed personnel in the recovery corridor of a civilian hospital in the middle of the night. She uncrossed her arms. "I want vitals every 10 minutes during transport. I want a full surgical kit in the vehicle. And I want someone with actual trauma experience in that unit with him, not just a medic." Done, Nora said. That means you're going. That was always the plan. Quan looked at her for a moment. The particular look of a specialist who has just realized she has been negotiating with someone who already knew the outcome. He's a lucky man, Quan said finally, meaning it about the surgery, and maybe about more than that. He's not lucky yet, Nora said. Let's move. The transfer happened at 2:17 a.m., and it was not clean. Clean would have been Teal stable and unresponsive in a secured gurney. A straight shot from recovery to the transport vehicle in the East Bay, no complications. What happened instead was that his blood pressure dropped 12 points during the gurney move. Not catastrophically, but enough that Nora called a halt in the corridor and spent 4 minutes with her hands on him and her eyes on the portable monitor before she was satisfied it was positional and not something tearing loose inside him. The two military medics with the transport unit were good. She could see that. They moved efficiently and they didn't argue when she redirected them, which told her they'd been briefed on who she was, or at least on the fact that they should listen to her. One of them, a young woman named Specialist Dara Finch, according to her tape, handed Nora a new pressure cuff without being asked, which was the specific kind of competence that Nora actually trusted more than credentials. Orientation to the vehicle? Nora asked her. Left rear cabinet, trauma kit. Chest tube supplies are in the yellow case. We have 2 units of ONEG and 4 of his type. SAT monitor and portable vent are both live. Good. Stay on his left side. If his pressure drops below 80 systolic, you call it before the monitor does. Understood. They moved. The East Bay was supposed to be secured. Cole's team had swept it 20 minutes before, but as the gurney came through the bay door and the night air hit them, cold, November sharp, the kind that made you aware of every exposed surface, Nora felt something she hadn't felt since she'd stopped being Nightfall. Not a sound, not a visual, just the calibrated internal alarm of someone who had spent 3 years learning to trust exactly that sensation. Hold, she said. The team stopped. Cole, 2 steps behind her, went very still. She was looking at the east loading dock, the parked ambulance on the far left, the gap between the second SUV and the hospital wall. The ambulance, she said, it was nose in when I came through here at 1 Onwa. Cole looked. The ambulance was now backed in. He had his radio up before she finished the sentence. All units East Bay, we have a... The bay door on the ambulance opened. Not a person. A device, small, magnetic, attached to the bay door's interior handle. It dropped to the concrete with a sound like a coin, and every person in that loading dock who had any training at all took exactly the same action in the same half-second. Cole's officer was already moving toward the device when Finch put herself between the gurney and the ambulance, which was either very brave or very trained or both. And Nora was doing the opposite of what instinct wanted. She was turning toward Teal, checking his lines, making sure nothing had pulled during the sudden stop, because in her assessment the device was a distraction and the actual threat was something they hadn't seen yet. She was right. The exterior door to the left of the bay, a maintenance access that should have been locked, opened from the inside. 2 men, civilian clothes, which meant nothing, moving fast and low and with the specific economy of people who didn't need to waste time looking purposeful. Cole's team was on them in 4 seconds. 4 seconds is a long time if you're counting it out loud, and a very short time if you're watching 2 federal officers and 2 military personnel converge on 2 unknowns in a hospital loading dock at 2:20 in the morning. There was no gunfire. One of the men got a hand on the gurney rail before an officer had him controlled. The other one made it 5 steps past the maintenance door before the second officer caught him. Teal's monitor alarmed. He's at 78, Finch said. Nora didn't look up from what she was doing. Bolus the saline wide open, 20 seconds. Starting now. Someone get me a read on his right arm. Finch got her the read. Nora assessed. The pressure had dropped because of the physical disruption, the movement, the stopped gurney. Not because anything had gone wrong internally. She gave it 90 seconds and watched the number come back up. 83, 87, 91-1. Okay, she said. Let's move, faster this time. Oh. The transport vehicle was a converted medical unit, military grade, with shock-dampened suspension and enough equipment to handle most of what a forward surgical team would need in the first hour of a crisis. Nora had worked in worse. She had worked in a tent with generator power and a sandstorm outside, which recalibrated your definition of adequate pretty significantly. She rode with Teal in the back, Finch across from her, the second medic up front. Cole was in the lead SUV. For the first 20 minutes of the drive, everything Nora had was on the patient: pressure, saturation, respiratory, the wound site, the forearm dressing. Teal was sedated, but the sedation was wearing at the edges. She could see him starting to surface, the micro movements of his face that meant consciousness was trying to reassert itself. She didn't rush it. When his eyes opened, they were unfocused for about 30 seconds. Then they found her. "Hey," she said. His mouth worked. No sound. "Don't try to talk yet. You had chest surgery and we're in a vehicle. You're secure." His eyes moved around the interior of the transport, found Finch, found the equipment, came back to Nora. "Hospital," he managed. One word, rough from the intubation. "We moved you. It wasn't safe there anymore." He absorbed this without visible alarm, which told her something about what he'd been through before tonight. "You're Nightfall," he said, still just working with the minimum words. "I used to be." "Teal." He tapped his own chest with 2 fingers weakly. "I know who you are, Sergeant." "How bad?" "You're going to keep the arm. The chest is going to hurt for a while, probably 6 weeks." A sound that might have been a short laugh, cut off by pain. 6 weeks is good. By your standards, I'm not going to ask." He was quiet for a moment. His hand moved toward his left side, the instinct to check your own wound that she'd seen in every soldier who'd ever come back to the surface after surgery, and she caught his wrist gently before he got there. "Leave it," she said. He left it. "They were waiting," he said, "at the hospital." "I know." "They knew which route." "I know that too. We're working on it." His eyes went to the ceiling of the transport. "The drive. I had a drive with me. Left thigh pocket." He paused. "It was there when they loaded me." Nora looked at Finch. Finch shook her head slightly. The gear had been cataloged by the hospital staff before the military arrived, and by the time Cole's people got there, it had already been through at least 2 sets of hands. "We'll look into it," Nora said. "You need to look into it right now." Teal's voice had gone flat and specific, in the way that voices do when someone is saying the most important thing in the conversation. "What's on that drive is why they tried to kill me tonight, and if they have it—" He stopped, breathed through the pain of having talked too much. "Then tonight doesn't end here," Nora said. "No," he said, "it doesn't." She looked at the monitor. She looked at his face. "Rest," she said. "I'll handle the drive." He looked like he might argue. Then whatever energy the sedation had left him ran out, and his eyes closed, and he was under again. Nora pulled out her phone and typed to Cole. "Teal says there was a drive in his left thigh pocket. Went through hospital staff intake before your team arrived. We need the chain of custody on everything that was logged from his gear tonight." The reply came back in under a minute, already pulled. 3 items logged. No drive. She read it twice. Then she typed, "Who logged the intake?" "Cole." "Checking." She put the phone face down on her knee and looked at the partition between the back of the transport and the front cab. The medic up front was driving. She could see the back of his head through the window. She looked at Finch. "You were in the bay during the full transfer?" "Yes, ma'am." "You see anyone go near his gear before it was loaded?" Finch thought about it. Actually thought, didn't just answer. "One of the nurses. Short guy, dark scrubs. He was doing something near the gurney when we were dealing with the pressure drop. I thought he was checking lines." "Did you see his badge?" "Not clearly." Nora typed, "Pull badge access logs for the East Recovery Corridor between 2:00 and 2:15 a.m. I need to know who was near that gurney during the BP event." She put the phone down again. The transport hit a long, smooth section of highway, and the ride leveled out. Outside, the Colorado night was complete and dark, the mountains invisible again, just the white dashes of the road coming and going in the headlights. Finch was watching her, not obtrusively, just the quiet attention of someone who is trying to learn something. "You were really special operations?" Finch asked. Then immediately, "Sorry, that's not... I don't need to..." "It's fine." Nora kept her eyes on the monitor. "A long time ago." "But you came back. Tonight." "I came back for him specifically." She looked at Teal's face, still and worn, the face of someone who had been through more than this night. "Not for the rest of it." "The rest of it seems to be coming anyway." "Yeah," Nora said. "It tends to." Her phone lit up. "Cole." Badge access log shows an authorized hospital ID entering recovery at 2:09. ID belongs to a biomedical technician named Renner Gordon. Scheduled maintenance on monitoring equipment, except maintenance was signed off yesterday. The work order was completed at 4 p.m. Then, 5 seconds later, Renner clocked out at 5:30 p.m. Badge should not have been active at 2:09. Then, we have a photo. The photo came through. A man in dark scrubs, the angle from the corridor camera, face partially toward the lens. Not a maintenance technician. The posture was wrong, the movement pattern was wrong, and he was holding something at his side that a biomedical tech doing a follow-up check on monitoring equipment would have absolutely no reason to hold. It was a small drive. Black rectangular case, the size of a thumb. Nora stared at the photo. Then she looked at the timestamp. 2:09 a.m. The BP drop that had halted them in the corridor, which she had assessed as positional, which she still believed was positional. But someone had known exactly when that halt would happen, and for how long it would last, and had used those 4 minutes with precision, which meant the BP drop hadn't been incidental. Someone had caused it. She went back through the medications administered during the transfer. The sequence, the timing, nothing that Finch had given him, nothing she'd ordered, but there had been a 10-minute window in recovery before the transfer, when Teal had been under monitoring by the hospital's own recovery staff, and she hadn't been in the room for all of it, because she'd been in the corridor with Cole reviewing the footage. 10 minutes. Long enough for something to be introduced into a line that would drop a pressure at a predictable interval later. "Finch," she said, "when did you do his last line check?" Finch knew immediately what the question meant. Her face changed. "Before we transferred him out, I pulled the line to recite it. Standard for transport. The old one had been in for over an hour." "You pulled the old line?" "Yes, ma'am." "Where is it?" "In the Sharps bag. In the yellow case." Nora went to the yellow case, found the Sharps bag. Inside it, the pulled IV line, capped, as it should be. She held it up to the light in the transport vehicle. There, just above the injection port. A mark so small you'd miss it if you weren't looking for it. A puncture that hadn't been there when the line was placed, because if it had been there, the paramedics would have caught it during their initial assessment. It had been added between when Teal entered recovery and when Finch pulled it. Someone had injected something through the port, something that would suppress blood pressure temporarily and predictably, timed to the transfer. A distraction. To create a window. To take the drive. She put the line back in the bag and sealed it. Her hands were steady, which was not because she wasn't feeling anything, but because she had trained her hands to be steady independently of what she was feeling, and that training had never entirely gone away. She typed to Cole, "I need the bag that came off his IV pulled as evidence. It's in the transport now. And I need to know if Gordon Renner has any connection to the Boyle file." She put the phone down. Teal was still under. The monitor showed steady. Outside, the highway curved into the dark, and ahead of them the lights of the military installation at Varden Point became visible on the ridge. Not much, just a scatter of white and amber against the black, but enough to navigate toward. She sat back against the transport wall. She was thinking about the drive, about what Teal had been willing to die for, about the fact that it was now in the hands of someone who had been willing to drug a post-surgical patient in a recovery ward to get it. She was thinking about Harwick, 8 blocks from the hospital, making a call he shouldn't have made. She was thinking about Boyle. She was thinking about the fact that Boyle's flagged number connected to 3 open federal investigations, none of which had closed cleanly. She was thinking about how none of this had started tonight, how it had been moving for a long time, through channels and favors and small compromised decisions, toward a point where a sergeant with a drive in his thigh pocket ended up bleeding out in a civilian ER, counting on the one person nobody in that building had believed in. Her phone lit up one more time. Cole. The message was 4 words. Renner doesn't exist. And below it, 2 seconds later, the ID was fabricated, 3 weeks ago. Someone built a full hospital employee profile, access codes, work orders, maintenance logs, for a person who has never worked there. This was planned long before tonight. Nora read it. She put the phone away. She looked at Teal, and then her eyes went to the transport's front cab, to the medic behind the wheel, and she realized, in the same quiet, calibrated way she'd realized about the ambulance position in the loading dock, that she had not personally verified this driver. She had verified Finch. She had verified the second medic. She had not verified the driver. Cole's team had cleared the vehicles, but Cole's team had been working on 40 minutes of sleep in a situation that had developed faster than any of them had planned for, and cleared didn't mean verified, and the driver had been provided by the base logistics unit, which had been coordinated by an officer she hadn't met. She looked at the back of his head. He had not said a single word since they'd left the hospital. She looked at Finch and kept her voice at normal conversation volume, because normal was the only thing that made sense right now. "Finch," she said, "what's the driver's name?" Finch glanced at the partition. "Corporal Weeks, Jason Weeks. He's been with the transport unit for—" She stopped. The way Nora was looking at the partition made her stop. "I've worked with him twice," Finch said, more quietly now. "When?" "6 months ago, and last spring." "Call it out to him." Finch leaned toward the partition. "Hey, Weeks." The driver didn't answer. "Weeks." Nothing. The transport was doing 72 miles per hour on a highway with no other vehicles in sight, 40 minutes from the installation, and the man behind the wheel had not responded to his own name. Nora moved before she finished deciding to move. She was out of her seat and at the partition in 2 steps, and she did not knock or ask. She pulled the connecting panel open and looked at the man behind the wheel. He was upright, eyes forward, both hands on the wheel at the correct positions. Everything about his posture said functional, except that he hadn't answered his name twice, and his shoulders were too still for someone who was genuinely relaxed, and the way his jaw was set had the specific tension of someone concentrating very hard on appearing not to be concentrating. "Weeks," she said. He turned his head. His eyes were clear. He was present. "Sorry," he said. "Headphones." He held up one earbud that had been in his right ear. "Dispatch frequency. Didn't hear you." She looked at him for 3 full seconds. He held the look without flinching, which meant either he was telling the truth or he was very well trained, and right now those 2 categories felt dangerously close to each other. "Patch dispatch through the cab speaker," she said. "Rest of the drive." A beat. "Yes, ma'am." She pulled the panel half shut and returned to her seat. Finch was watching her. Nora shook her head slightly. Not an all clear, just a not yet. She checked Teal's monitor. Stable. She checked the sealed Sharps bag. Still there. She typed to Cole. "Need immediate verification on transport driver. Corporal Jason Weeks, Varden Point Logistics. Visual confirm if you have eyes behind us." 60 seconds passed. Then, "Confirmed. Weeks is logged as assigned. Photo matched to your vehicle's forward camera. He's clean." Then, "Why?" She typed back. "Didn't respond to his name. Says headphones. Dispatch frequency." Cole. "Checking dispatch logs. 30 more seconds. Dispatch shows active frequency assigned to that vehicle." He was on it. She put the phone down and let out a breath. Slow, controlled, the kind that doesn't look like anything from the outside. Not relief exactly. Recalibration. The difference between paranoia and methodology was what you did when the check came back clean. Paranoia found another wire to pull. Methodology filed the result and moved. She moved. Outside, the installation at Varden Point resolved from scattered ridge lights into an actual facility. Perimeter fencing, a checkpoint with 2 guards and a barrier beam. They confirmed the convoy. The beam lifted. They rolled through. The medical unit at Varden Point occupied a low concrete building that looked like nothing from the outside and was entirely functional on the inside, which Nora respected more than she could explain to anyone who hadn't worked in places that looked impressive and couldn't keep a patient alive past hour 2. They got Teal into a bed by 3:10 a.m. The physician on duty was Major Lena Strauss, but mid-40s, direct, who introduced herself with the efficiency of someone who had been awake since the previous morning and was not going to pretend otherwise. She reviewed the surgical notes, the medication log, the transport vitals, and the pulled IV line without speaking for almost 4 minutes. Then she held the line up to the light the same way Nora had, in the transport vehicle, and looked at the puncture mark above the injection port. "You're thinking something was introduced through this," Strauss said. "I'm thinking the blood pressure drop during the transfer was induced, timed, to create a retrieval window." Nora kept her voice factual. "I need a full expanded tox panel, not the standard hospital screen. Whatever was used would have been short-acting, targeted, designed to clear fast." If it's already cleared, the panel is confirmatory, not diagnostic. I know. I want the record. Strauss looked at her for a moment, not with skepticism, but with the focused attention of someone who is integrating new information into an existing picture and finding the picture larger than expected. I'll order it, Strauss said. She handed the IV line to a nearby tech, gave 3 clipped instructions, and moved to Teal's bedside. Nora stepped back. The medical piece of this night had reached the point where it was being managed by the right people in the right place, and the other pieces had not. Cole found her in this corridor at 3:35 a.m. She was standing with a water bottle a young specialist had pressed into her hands, and she was drinking from it without tasting it, running the sequence again in her head the way she always ran sequences, looking for the gap she'd missed, the beat that didn't fit, the detail that was pointing at something she hadn't yet identified. Sit rep, Cole said. Not an order, a request. The register he used when the situation had passed a certain threshold. She gave it to him clean and linear. The IV line, the timing, the fabricated biomedical tech identity, the drive, what Teal had said about the drive, what the drive meant if it was now in the wrong hands. Cole listened without interrupting. When she finished, he said, Gordon Renner's identity was built off credentials from a real hospital employee who died 14 months ago. The access card stayed active because the department's HR turnover paperwork had a clerical lag. Nobody audited it. He paused. Someone tracked that lag, knew exactly when it was exploitable. That's not improvised, Nora said. His mission for weeks at minimum. A pre-positioned intercept plan for wherever he surfaced in a tri-state area. He looked at the door to the medical unit. He surfaced in your ER. He surfaced in Creston because that's where the transport reached before he bled out. That wasn't targeting. That was geography. She turned the water bottle in her hands. But whoever tracked Renner's credentials knew within minutes that Teal was at Meridian Valley, which means they had a watch on area trauma centers. Agreed. Harwick's call to Boyle was at 1:22. That's 40 minutes after Teal came through the doors. She looked at the floor. Harwick didn't tip them to the hospital. They already knew. Harwick told them something else. Cole went still. He told them you were there. He told them Nightfall was there, which changed their timeline. They weren't originally planning to use the hospital employee scheme that fast. I think that was accelerated because of me, because they knew I'd flagged the problems before their slower plan could work. She looked up. They've got a file on me. That file is supposed to be classified. Supposed to be. Cole's expression did something complicated that resolved into the look of a man who has just added a significant variable to an already difficult equation and is not happy about the math. I'll pull the access logs on your jacket, he said. If someone's been reading it, there'll be a trace. And I want to know who cleared the Renner card access without auditing. That's not an IT oversight. Someone kept it off the audit list. Already running it. They stood in the corridor and the installation made its night sounds around them. Distant generators, a door somewhere, the specific ambient silence of a secured facility that is never fully silent. The drive, Nora said. What was Teal carrying? Cole weighed something. She could see him doing it. Warren, she said. She almost never used his first name. He registered it. Supply chain records, he said. Payments. Routing information for contracts that were supposed to supply forward operating bases in 3 theater zones over a 4-year period. Contracts that were bid through legitimate channels and then skimmed. Not the whole amount, just enough that the material still arrived. Just short. Just degraded. Wrong medications. Substandard equipment. Things that failed when they needed to work. Nora heard this without visible reaction, but something moved behind her eyes. How many casualties tied to it? She asked. We're still counting. Conservative estimate, the equipment failures contributed to outcomes in at least 31 cases, possibly more. 31. She let that number sit. She didn't say anything about it. And Boyle's connected to the contracting, she said. Boyle managed the vendor relationships. He's not the top. There are people above him. But he's the operational layer. And he's the one who built the cleanup apparatus, the false identities, the intercept protocols. Cole's jaw set. Teal got into the financial layer through a contact inside the contracting office. Someone who had the records and was scared enough to pass them, but not scared enough to come forward officially. Teal was bringing the drive to a federal handler in Denver. Who knew about the Denver meeting? That's the question we've been sitting on for 11 days. Nora thought about this, about the shape of it, about the fact that someone with access to a classified operations schedule, a federal handler's identity, and her own sealed military file had been running a parallel network inside legitimate institutional structures for years. Not obviously, not loudly, but persistently, in the gaps and the lags and the clerical delays and the access cards that nobody bothered to audit. They're not going to stop at the drive, she said. No. Teal's the direct witness. He was at the originating contact. He can place Boyle at specific decisions. She turned toward the medical unit door. As long as he's alive and coherent, the drive is recoverable. They can reconstruct data. His testimony is harder to replace. Cole looked at her. Strauss has him, she said. But Strauss doesn't know what she's protecting against. I'll brief her. Brief her now. And I want to know the security posture on this building, who has access, how it's logged, whether any of the overnight staff came on rotation in the last 3 weeks. She was already moving. Because the Renner protocol wasn't a one-off. If they built one false identity, they built others, for exactly this kind of contingency. Strauss took the briefing with the stillness of someone who was recalibrating in real time and not letting it show, which Nora respected. Afterward, she pulled 2 of her medics off peripheral duties and repositioned them inside the room with Teal. She changed the keycard access protocol on the unit door to require dual authorization. She was not happy about any of it, and she didn't pretend to be. I've had patients with security details before, Strauss said. Not like this. Hopefully not like this again, Nora said. Is he going to make it? Medically, yes. He's in better shape than he should be, she paused. The rest depends on things that aren't medical. She took a position in the room across from Teal's bed, not at the bedside, not in the way, but close enough to monitor his rate without looking at the machines. The way she'd learned to do it years ago when looking at machines meant taking your eyes off other things that needed watching. He was surfacing again. More slowly this time. The sedation was thinning in layers. At 4:14 a.m., his eyes opened and stayed open. He found her immediately, like he'd known exactly where she'd be. Drive's gone, he said. His voice was rough, but he wasn't uncertain. We know. Boyle's got people inside the federal system, not just contractors, actual agents. He swallowed. It cost him. My handler in Denver, Maria Reyes, she's the one I was going to. If Boyle's people know about the meeting, they know about her. Nora looked at Cole, who was in the doorway. Cole already had his phone up. We need to get to Reyes, Nora said. I'm trying, Cole said. She's not answering her secure line. When did she last check in? 11 hours ago. Nora thought about that number. 11 hours ago was before Teal's transport had been intercepted. Before any of tonight had started, officially, which meant either Reyes had gone dark intentionally, protocol, if she'd sensed something was wrong, or she'd been dark for reasons that were not protocol. She has a secondary contact, Teal said. He was watching the ceiling, conserving energy for the information. If she went to ground, there's a location, a place she and I designated before I went in. He paused. I can't give you the address in this room. Cole looked at him. You don't trust the room. I don't trust anything I can't see the whole perimeter of right now. He turned his head toward Cole, and there was nothing fuzzy in his eyes. No offense, General. None taken. Cole looked at Nora. She understood what he wasn't saying. Teal would give the location to her, not because she outranked Cole, she didn't have rank anymore, but because Teal had said her call sign in a trauma bay while he was bleeding out, which was its own kind of declaration. Cole stepped out of the room. Nora moved to the bedside. Teal told her in a low voice. An address, a cross street, a detail that would confirm Reyes had made it there. A specific object in a specific window. 23 words. She didn't write them down. Got it, she said. Don't lose it this time, he said, and the corner of his mouth moved. Not quite a smile. The ghost of one. I didn't lose it the first time, she said. I filed it incorrectly. This time it was a real expression, small and exhausted and genuine. Sounds about right for the Army. I was Navy adjacent. That explains the attitude. She stood. Rest. Actually rest. Strauss is good. I know she's good. He closed his eyes. I know you're better. She didn't answer that. She moved to the door. Cole had a secure vehicle running at 4:40 a.m., and 2 officers who had been cleared to 4 levels above the operational context of this specific mission, which was the closest thing to trustworthy they were going to get on 2 hours' notice. The address Teal had given was 47 minutes from Varden Point at highway speed. A residential neighborhood in a town called Ferris Mill. Small, grid-patterned streets. The kind of place that had a diner and a hardware store and no particular reason for anyone to look at it twice. Nora rode in the front this time. She did not sleep on the drive, which Cole noticed and did not comment on. He drove. She ran the address through everything she could access from her phone, building a picture of the block, the approach angles, the variables. They were 20 minutes out when her phone showed a notification from the base. The expanded tox results from Teal's panel flagged urgent. She read it. The agent found in the trace residue from the IV line was a compound called esmolol, which was a fast-acting beta blocker used in controlled clinical settings to manage acute hypertensive episodes. It would drop blood pressure rapidly, predictably, and clear a patient's system within 15 to 20 minutes of administration. It was also a medication that appeared routinely in hospital pharmacies. In a controlled clinical setting, correctly dosed by a physician managing an acute event, it was appropriate. In a post-surgical patient's IV line, administered covertly by someone pretending to check monitoring equipment, it was a precise, technically sophisticated act of sabotage. This was not Boyle's operation, not the main architecture of it. This was a specialized subunit, someone who understood pharmacology, who had access to medical-grade compounds, who had used the tool not to kill but to control, because killing Teal inside the hospital would have raised a different order of problem. They wanted the drive. They wanted Teal alive enough to be questioned later, if they could get to him. They'd calculated the dose not to harm him permanently, but to create the window. That required a specific kind of expertise. She forwarded the results to Cole's phone without speaking. He read them at the next long, straight section of highway, then put his phone down. Medical professional, he said, or someone trained by one. Narrows it. It also means Boyle's network isn't just contractors and bureaucrats. He's got people with clinical training in his apparatus. She looked at the dark road. Which means the hospital wasn't incidental. He knew a medical approach would work in that environment because he had the right person to run it. Cole drove. She could see him working through the implications. Reyes, she said. If Boyle's people have clinical assets, Reyes being dark for 11 hours, I know. She could be incapacitated, not killed. Same logic applies. She's more useful as leverage than as a casualty. She paused. Or she's already in a position where she's been stabilized and is waiting for someone to find the window signal. The object in the window, Cole said. Yes. They rode in silence for the next 8 minutes. The sky was beginning to change at its eastern edge. Not light yet, but the particular deep blue that comes before light, when the black softens but hasn't yet committed to anything else. Ferris Mill appeared without announcement. A water tower, a highway exit, a gas station with its lights on for nobody. Cole slowed to residential speed. Grid-patterned streets exactly as she'd pictured them. Houses dark, lawns quiet. The block came up on the right. She found the house number. She looked at the window. The object Teal had described was there, a specific item, placed precisely where Teal had said it would be if Reyes made it to the location safely. She's here, Nora said. Cole parked half a block back. His 2 officers got out first, moved wide, checked the perimeter. One of them gave the signal. Clear approach. Nora and Cole walked to the door. She knocked. The pattern Teal had given her. 3, pause. 2. 10 seconds. The door opened. The woman inside was in her late 30s, dark-haired, wearing a jacket over what looked like clothes she'd been sleeping in but hadn't slept in. Her left hand was wrapped in a field dressing. Gauze, medical tape, not a hospital job. Her right hand was behind the door frame. Her eyes went to Nora first, then Cole's rank, then back to Nora. "You're Nightfall," she said. "Teal sent me." Reyes exhaled. It was the exhale of someone who has been holding a position for an unknown duration and has just been told they can move. She stepped back from the door. They went inside. The house was a safe house, bare minimum furnished, clean sight lines, one exit at the back that Nora clocked immediately. Reyes had checked it too. The rear door had a chair tilted under the handle. "They came for me at 3 a.m., Reyes said, sitting on the edge of a chair and unwrapping the dressing on her hand slightly, checking it without thinking. 2 of them. At my apartment. I'd already left by then. I made the call 6 hours earlier when Teal's transport went off my tracker. Your hand, Nora said. Window, going out fast. She rewrapped it. I'll live. I need to look at it. Later. Reyes looked at Cole. The drive. Tell me Teal still has it. Cole's silence told her the answer before he spoke. It was taken during transport, he said. We have the retrieval vector. We're working on locating it. Reyes closed her eyes for exactly 2 seconds, then opened them. Then we have a problem, because the drive has a dead man's switch built into it. If it's not authenticated by Teal's biometric within 72 hours of being separated from his person, the encryption triggers a wipe. Then we need to recover it in 72 hours, Cole said. 64 now, Reyes said. It separated from him at the hospital. She looked at her watch. And if Boyle's people can't break the encryption, which they can't, not in that window, they're going to do the next logical thing. Nora already knew what she was going to say. They're going to bring Teal to the drive, Nora said. Yes. Which means they're going to try to take him out of Varden Point. Reyes nodded. Nora turned to Cole. We need to go back. Cole already had his radio up. And that was when the lights in the safe house went out. All of them, simultaneously, including the streetlights visible through the front window. And in the sudden, complete dark, Reyes said one word, in a voice that had gone very flat and very controlled. Back door, she said. Something hit the front of the house. Not a knock. The sound that hit the front of the house was not an explosion. It was a ram, handheld, the kind used for forced entry, and it connected with the door's lower panel rather than the lock, which meant whoever was outside had done this before and knew that the lock itself was less useful to destroy than the integrity of the frame. Nora was already moving. She had the back door chair in her hand before the second impact came, and she passed it to Cole's second officer and pointed at the kitchen entry without speaking because there wasn't time, and because the geometry of the house told her everything she needed about what was happening. Front entry compromised. Back was the exit. Left flank was a window with a 3-foot drop to a side yard connecting to an alley. Window, she said to Reyes. Reyes didn't argue. She moved to the window, checked the alley in the half-second she had, and went through it with the economy of someone who had done this in training and had apparently also done it in practice, because her movement carried no hesitation. Cole was on his radio, voice controlled below the volume of the impacts. Ferris Mill, Grid 77 Echo, we are under active breach, need immediate. The front door came in. Not all the way. The frame held on the security side, but the panel buckled and the man who came through the gap was already low and moving, which confirmed military or paramilitary training, and Cole's first officer met him in the hallway with the specific violence of someone who had been waiting at that position and was not surprised. Nora went through the window. The alley was behind a wooden fence, 4 feet of dead grass between the house's foundation and the fence line. November cold hitting every exposed surface immediately. Reyes was already at the fence. Nora went over without stopping and came down on the far side in gravel, caught her balance, kept moving. Behind them, the house produced the sounds of a controlled engagement. Not gunfire. Not yet. Just the percussion of bodies against surfaces and the short, hard sounds of people fighting in confined spaces with no room to be imprecise. Cole came over the fence 30 seconds behind Nora. His radio was still active. 2 officers on site, 1 engaged. We are mobile, moving east on the alley behind Grid 77 Echo. Need intercept at... He gave a cross street from memory, which she registered and filed. They ran. Reyes was fast for someone with a field-dressed hand and no sleep. She ran with her head down and her stride short and efficient, and Nora matched her without difficulty. And Cole, who was 58 years old and had made a decision about staying physically capable decades ago and maintained that decision through pure stubbornness, kept pace 4 steps behind. 3 blocks in the dark before Cole's radio gave them the intercept position. The second SUV was at the cross street, engine running, the officer behind the wheel already watching the alley mouth. They got in. He pulled out before the doors were fully closed. Nora didn't speak for the first 4 minutes. She was running the sequence. The lights going out? Not a power failure, because the street lights had cut simultaneously with the interior, which meant a block-level interruption, which required either a utility system intrusion or someone physically at a junction box, and both options required advanced positioning. They had been inside the house for 11 minutes before the breach. 11 minutes was not enough time to stage a block-level cut, unless the team had already been in the neighborhood when Nora and Cole arrived, which meant Reyes had been tracked to Ferris Mill before their vehicle pulled up, which meant either Teal's contingency information had leaked before he gave it to Nora, or Reyes had been followed on her way in despite her counter-surveillance, or the address had come from a third direction, through whatever access had given Boyle's network her classified file, through some layer of the institutional structure that she couldn't yet see clearly enough to name. She looked at Reyes in the seat beside her. Reyes was pressing her wrapped hand against her thigh and looking out the window with the expression of someone running the same kind of accounting. "How did you get to Ferris Mill?" Nora asked. "Drove 3 reroutes, checked for a tail at each change." "Vehicle registered to you?" "Lease entity, clean, 3 layers removed." "How long were you in the house before we arrived?" Reyes thought. 4 hours, roughly." "You didn't use your phone?" "No, secure radio only. 1 check-in to confirm the window signal was placed." "Then the address didn't come from your movement." Nora looked at the back of the driver's seat. "It came from inside Varden Point." Reyes went still. "What?" "Teal gave me the address in an open room at the installation. Cole had stepped out. Strauss and her team were present. The room had been secured, but the sweep was done by personnel who'd been on rotation and hadn't been independently verified." She kept her voice even. "We arrived at Ferris Mill 47 minutes after Teal spoke. They were pre-staged. The timeline doesn't work any other way." Reyes looked at Cole. Cole's expression had the particular quality of a man who knows the conclusion he's being walked toward and is verifying each step before he accepts it. "Varden Point has a compromised channel," Nora said. "That's a serious claim for a secured installation," Cole said. "It's the only claim that fits what just happened." She turned to look at him directly. "Which means they know we're mobile right now, and they know we're heading back." Everyone in the vehicle arrived at the same place simultaneously. "Teal," Reyes said. "They moved us out of the installation," Nora said. "Ferris Mill wasn't the primary objective. It was the mechanism to get us away from him." Cole was already on his radio. "Varden Point Medical, this is Cole. I need eyes on Sergeant Teal. Verbal confirmation. Right now." Static. Then, "General Cole, this is Specialist Finch." Her voice had the slightly elevated pitch of someone maintaining composure by effort. "I'm looking at Sergeant Teal. He's present and stable." "Who else is in the room with you?" A pause, 1 beat too long. "Major Strauss stepped out approximately 20 minutes ago, a supply concern in the pharmacy, and the 2 medics were redirected to—" "Finch," Cole's voice cut clean. "Lock that room immediately. Wedge the door. Do not open it for any person until I am physically standing in front of you. Do you understand?" "Sir." "Right now, Finch." In the background behind her voice, clearly audible through the radio, was a sound. Not an alarm. A smaller sound. A door handle. "Someone's in the corridor," Finch said, and the quality of her voice had shifted to something flatter and more controlled, which was its own kind of alarm. "Lock it." Static. Cole told the driver, "Go as fast as this vehicle physically allows." The driver went faster. The next 24 minutes were the kind that don't compress into summary. They existed at full length, each one distinct, the highway coming at them in the headlights, and the radio giving nothing useful, and the Colorado sky beginning its slow change from black to something that hadn't yet decided what color it would become. Nora spent those minutes in the operational state she had learned. Not absence of feeling, but conversion of it. The fear became a list. The list had items, and the items had sequences, and the sequences had dependencies, and she worked through the dependencies because that was what the situation required and what she had trained herself to do in places where the alternative to working through it was freezing, and she had never once frozen. The list said Finch was alone in that room with a man who was sedated and post-surgical and the only living witness who could directly place Boyle inside the operational decisions of the supply chain fraud. The list said Strauss had left with 20 minutes lead time, which was precise enough to be deliberate. The list said the pharmacy concern that pulled Strauss out was a soft manipulation, plausible, institutional, the kind of excuse that generates no suspicion in a facility that runs on protocols. She went back through Strauss in her head, the thorough review of the surgical notes, the IV line held up to the light, The talks panel ordered without argument. The security posture upgraded. The dual authorization door protocol. The medics repositioned inside the room. All correct. All exactly what you did if you were managing a compromised patient with a genuine security threat. All also exactly what you did if you needed to demonstrate trustworthiness in the window before you had to be absent. She didn't say this to Cole. She needed one more data point before she said it. She typed it to herself instead, in the Notes app on her phone, in plain language, time-stamped. They came through the Varden Point checkpoint at 5:08 a.m. Cole was moving before the vehicle stopped, Nora with him, Reyes 3 steps back with her wrapped hand against her body, and her eyes mapping the facility layout as she ran it for the first time. The medical building was 60 meters from the gate. They covered it below a run, but well above a walk. The corridor outside the medical unit was quiet in the wrong way. Not occupied quiet. Held quiet. The door was closed. Cole went to the keycard panel. Stopped. Dual authorization. His card was 1. He needed a second and Strauss wasn't present and the door might be wedged anyway. Nora knocked. 3. Pause. 2. 4 seconds. The sound of something being shifted from behind the door. Then the lock. Finch opened it with the face of someone who has been more frightened than they've ever been in a professional context and has managed it by focusing entirely on the immediate task in front of them. She was holding a blood pressure cuff in her left hand that she had clearly picked up as the nearest solid object without thinking about it. She stepped back. Teal was in the bed, alert. More alert than he'd been in the transport, the sedation layers thinning further. His eyes found Nora and did the thing they had done before. The specific accounting of someone who has been close to a very bad outcome and is now revising their assumptions about the alternative. Strauss, Nora said to Finch. Where exactly did she go? She said pharmacy, building C. Finch glanced at the wall panel. She called from inside the facility. Room phone. Show me. Finch pulled up the internal call register. Nora looked at the origin extension. She looked at Cole. I was already on his radio, asking the base duty officer for Major Strauss's current location. 30 seconds. Strauss is logged to officer's quarters, the duty officer said. She clocked out of medical at 4:47. Physical gate sign-out confirmed. Nora looked at the call register again. The call to the medical unit's room phone, the call that had pulled Strauss's own attending out of the patient's room, had been placed at 4:44 a.m. from an extension in Building C Pharmacy, 3 minutes before Strauss clocked out of medical. She made the call herself, Nora said. Not to the room, to herself, working it aloud because it needed to be in the air. From the pharmacy extension, then walked back, told the room she needed to go to pharmacy, and left. She looked at Cole. The call manufactured its own pretext. Cole stood very still. Pull her personnel file, Nora said. Full record. Not the version that's on the base system, the unredacted version from the source agency. And I want to know when she was assigned to Varden Point, specific date. Cole made the call. While he was making it, Nora went to Teal's bedside. He was watching her with the patient attention of someone who has learned that watching carefully is a survival skill. Strauss, she said quietly. He looked at the ceiling, then back at her. She was good in the field, he said slowly, before she went medical. You knew her before tonight? Not personally, by name. She came up in a briefing, 6 months ago. Someone flagged her reassignment to Varden Point as irregular. She'd requested it. Physicians don't usually request a post like this. You didn't report it. It was flagged. It was in the file that Reyes was supposed to receive. He paused. The drive. Everything on the drive. Strauss's reassignment, if it was in there, was one thread among dozens, and it hadn't risen to the level of immediate action yet, because there were 50 other threads ahead of it. The drive that was now in Boyle's hands with a 62-hour window on its encryption. Nora straightened up. Where would Strauss go? She said, to no one specifically. She's made. She knows we're back. She can't stay on base. She signed out at the gate, Finch said quietly. That means she's already off the installation. Cole lowered his radio. His expression had changed. The specific change that comes when a data point arrives that reconfigures the whole picture rather than adding to it. Strauss was reassigned to Varden Point 11 weeks ago, he said. Requested posting. Approved by a Colonel Whitmer in the Medical Command Office. He paused. Whitmer retired 6 weeks ago. Accelerated retirement, under review for administrative irregularities in the contracting division. The contracting division, the same institutional layer that Boyle operated in. Nora looked at Reyes. Reyes said, "She's not a bystander. She's a plant. She's been here for 11 weeks building cover, and they activated her tonight because they needed the room cleared. And she's had access to this facility, this patient, and this medical unit's pharmaceutical supply for 11 weeks, Nora said. The implication landed in the room, and nobody spoke for 2 seconds. The tox panel she ordered on Teal, Nora said. I want it run again, independently, with a different technician and a fresh sample. She looked at Finch. Nothing from the current pharmaceutical stock in this unit until we've audited it. New supply from a separate building, separate chain of custody. Finch moved immediately. No hesitation, no question. The kind of competence that didn't need to be reassured. Cole was on 2 simultaneous calls. The gate, the base perimeter, Strauss's vehicle registration. Nora looked at Teal. She had access to your IV lines, she said. I know. Is there anything you're feeling right now that wasn't there before? Any change? He ran an honest internal assessment. She could see him doing it, not dismissing it, not catastrophizing it, just checking. No, he said. Same as before. Tired. Arm hurts. Chest is... He stopped. Actually, my vision. Left edge. He moved his eyes left and right. It's been slightly off for the last hour. I told myself it was the sedation wearing. Nora looked at his pupils. Left and right. The left was slightly more dilated than the right. Not dramatically, not enough to alarm a monitoring system on its normal parameters. Enough to alarm someone who was looking directly at it. Finch, she said, and Finch was back in the room in 4 seconds with the word coming out of her mouth before she finished entering. I need a neuro assessment and a head CT, and I need to know what medications were administered to this patient between 4 and 4:47 a.m. Finch pulled the log. 4 medications in that window. 3 were standard post-surgical management. The 4th was a pain management supplement logged at 4:31 a.m. Administered by the attending on duty. Administered by Strauss. 16 minutes before she called herself out of the room and left. Nora looked at the medication name, looked at the dosage, looked at the timestamp. She looked at Teal's left pupil. The medication was legitimate, appropriate for his presentation, correctly dosed by the chart standards. But there was a specific compound interaction that occurred when that medication was combined with a secondary agent, one that would not show in a standard tox screen, one that would produce a slow, progressive neurological effect, presenting initially as mild visual disturbance and progressing over 4 to 6 hours. Not enough to kill him tonight, enough to make his testimony inadmissible, enough to leave him cognitively compromised in ways that would look like surgical after effects, that would take weeks to diagnose correctly, that would push any federal hearing far enough into the future that the drive's encryption would long since have wiped and the case would have nothing to stand on. She had not been trying to take him out of Varden Point. She had already done what she came to do. Get me reversal agents for a probable serotonin pathway interaction, Nora said. New stock, different building. I need it in this room in 10 minutes. She looked at Teal. Stay awake. Talk to me if you need to. Don't let yourself drift. I'm not drifting, he said. But his left hand had moved to grip the bed rail, which was the unconscious action of someone who is not as certain as they're trying to sound. I know. Stay with me anyway. Cole stepped close. How bad? Caught early? Manageable? An hour later? She didn't finish it. The CT will show if there's been any vascular response. If not, we reverse it, and he'll be functional inside 4 hours. She looked at Cole. But she knew exactly what she was doing. This was designed to be invisible long enough to matter. She's been planning this since her reassignment. She's been ready to execute it since her reassignment. Tonight was the activation. Nora turned back to the patient. Which means Boyle knew weeks ago that Teal was getting close. He positioned her here as insurance. Not for a breach, for a slow operation that would leave Teal alive but effectively neutralized. Except Teal ended up in your ER instead of a DOA report. And now they're improvising around a situation they didn't plan for. Cole looked at her. That puts you at the center of everything they're trying to fix. I know. They're going to come at you specifically. I know that too. He held the look for a moment. Are you all right? It was a genuine question, not a formality. She heard the difference. "I'll be all right when this is done," she said, which was honest and was also the only answer she had. The reversal medication arrived at 5:41 a.m. from the base pharmacy in Building D, carried by a specialist who had been verified in person by Cole's officer at the door and whose chain of custody Nora checked herself before she administered anything. The CT was ordered, the imaging team mobilized, Teal transported to the scanning unit in the building's lower level, with Cole walking alongside and Nora on the other side of the gurney, and Reyes, who had found a chair and a position in the corridor where she could see both the elevator and the stairwell, watching everything that moved. The scan came back at 6:09 a.m. No vascular event, no structural change. Early neurological stress markers consistent with a compound interaction, which the reversal agent was already beginning to address. Teal would recover fully. Strauss had timed the dosage precisely enough that it would have done its intended work without leaving evidence of deliberate harm. If Nora hadn't noticed the pupil, if Teal hadn't mentioned the visual disturbance, if the medication log hadn't been pulled in the specific window it was pulled. 3 things that would not have happened if Nora hadn't been in this building tonight. She stood in the imaging corridor and looked at the scan on the screen and felt something that was not satisfaction and was not relief, and was not quite anger either. It was the feeling of understanding the full shape of something that had been assembled in pieces across a long time by people who had believed they could maintain it indefinitely. She called Reyes into the corridor. "The drive," she said. 61 hours left on the encryption. Roughly. "Boyle has it. He can't break it in that window. You confirmed that, which means his only play is to get Teal's biometric before the window closes. Or destroy the drive and eliminate Teal," Reyes said. "If both are gone, the case has no physical evidence and no direct witness. He's not going to destroy the drive. That drive has information that's useful to him if he can access it. Names of people who cooperated, documentation of payments, contact chains. He wants to own it, not burn it." Nora looked at the scan. "He's going to try to bring Teal to the drive, or replicate the biometric somehow. Biometric is a thumbprint and retinal. You can't replicate that." "You can if you have the right access to the right systems." Nora turned. "Who built the Renner identity? 3 weeks of work on a fabricated hospital employee. That's not amateur infrastructure. We're running the build chain. Run it against federal database access logs. Whoever built Renner's credentials had right access to a hospital HR system. That kind of access doesn't come from nowhere. It comes from someone who works inside an institutional IT framework with that level of reach." She paused. "Or someone who compromised someone who does." Reyes was already on her phone. At 6:23 a.m., 3 things happened in close enough succession that they felt simultaneous. The first, Cole's gate report came back with Strauss's vehicle, a blue sedan logged out at 4:51 a.m., tracked by highway camera to a travel stop 40 miles east of Varden Point, where it had been parked for over an hour. The second, Reyes's contact at the Federal Forensics Unit identified the build chain on the Renner identity. It traced to a single point of institutional access, a user account within a Department of Defense contractor database. The account belonged to a logistics analyst named Petra Vane, who had been with the same contractor for 9 years, and whose access credentials had been used to seed at least 4 fabricated identities across 4 different institutional systems in the last 18 months. Petra Vane, whose contracting firm had been audited twice in the last 3 years, and both times cleared by a review board that included, as one of its rotating members, a colonel in the logistics command, a colonel named Whitmer. The third, Teal, lying in the imaging unit recovery bed with the reversal medication working through him and his visual disturbance reduced to a minor edge phenomenon that was already fading, looked at Nora and said, "The drive. There's something I didn't tell Cole." She looked at him. "It's got a secondary access layer," he said, "below the encryption, something Reyes and I built in." He shifted slightly. "If the drive is plugged into a network device, any device, it broadcasts a location signal. Passive, tiny, only readable if you know the exact frequency." She stared at him. "You can find it," she said, "if you have the receiver protocol." He looked at her steadily. "Which I have memorized." The silence in the imaging corridor lasted about 4 seconds. Then Nora turned and said, "Reyes." Reyes was already in the doorway. We can locate the drive, Nora said, and Reyes looked at Teal, and Teal looked at both of them, and outside the narrow window at the end of the corridor, the Colorado sky had arrived at its decision, pale and cold and entirely clear. And somewhere 40 miles east of them, in a travel stop parking lot, a blue sedan sat with its engine running and a woman inside it who did not yet know that the slow, invisible operation she had run for 11 weeks had just developed a problem she had not been built to handle. And somewhere beyond that, in a location they did not yet have, but were now, for the first time, able to find, a drive sat inside a network device broadcasting a signal on a frequency that only 3 people in the world knew how to read. Nora said to Cole, "Get me a receiver, and get someone to that travel stop before Strauss moves." Cole said, "Both, now." And he meant it in the way that men with his rank and his experience mean things, not as an instruction to the room, but as a commitment, with the weight of everything that had happened in the last 6 hours behind it. Teal looked at the ceiling. His left hand had released the bed rail. "Nightfall," he said, to nobody in particular. She was already moving. The receiver protocol took Teal 8 minutes to dictate, and Reyes another 12 to configure into a modified signal unit that the base communications specialist assembled with the focused silence of someone who understood that the work mattered more than understanding why. It was 6:44 a.m. when the unit came online. The signal was faint, 41 miles east-northeast, which put it past the travel stop where Strauss's sedan had been tracked, further into a corridor of interstate that connected to 3 different secondary routes. Whoever had the drive had been moving, not fast, not erratically, just steadily, which was its own kind of professional discipline. Cole had 2 vehicles already mobile on the highway. He redirected them to the signal's bearing without explanation to the drivers, because the drivers didn't need explanation. They needed coordinates, and he gave them those. Nora looked at the receiver unit's screen. The dot moved with the specific regularity of a vehicle maintaining speed limits. Not fleeing, transiting. "They don't know we can see them," she said. "Not yet," Reyes said. "They will the moment we move to intercept." She looked at Cole. "We need the stop to look organic, a checkpoint, something that doesn't announce what it actually is." Cole was already making the call. State police coordination at the federal level took 4 minutes, which was faster than it should have been, and reflected the specific urgency that came through in his voice, and the specific weight of his rank, and the fact that the duty officer on the other end of that call had the clearance to understand what she was being asked to do without being told all the reasons. The checkpoint went up on the interstate at mile marker 194 at 7:02 a.m. The dot on the receiver was 11 miles out, Chet. Strauss was picked up at the travel stop at 7:08 a.m. by 2 federal officers who had been dispatched from a field office 60 miles away, and who arrived to find her still in the blue sedan, engine running, the seat reclined 2 inches in the way of someone who was waiting rather than resting. Her phone was in her lap. She had not made a call in the previous 43 minutes, which the tower data later confirmed, and the working interpretation was that she had been waiting for a check-in that had not come. She did not resist. She did not speak except to confirm her name and to ask, with the specific composure of someone who had prepared for this possibility, whether she was being arrested or detained. "Arrested," the lead officer said. She nodded once. She put her hands forward. The officers noted later in their report that she had already placed a sealed evidence bag on the passenger seat before they reached her window. Inside it was a personal phone, not her issued device, a second phone, and a handwritten note that said, "I want to cooperate. I want counsel first." It was, in its own way, the most professional thing anyone in Boyle's network did that entire night. It was also the action of someone who had known for a while that the architecture she was operating inside was not going to hold indefinitely, and had made certain preparations accordingly. The vehicle carrying the drive was a gray cargo van registered to a logistics firm that existed on paper in 2 states and physically in neither. The driver was a man named Terrence Alt, former military, medically discharged, whose financial records showed payments from 4 different contractor entities over the previous 22 months, all of which traced back, through layered corporate structures, to the same vendor network that Boyle managed. The checkpoint stopped the van at 7:19 a.m. Alt was cooperative in the way that people are cooperative when they believe the stop is routine and they have a story prepared for routine. He provided his license. He explained the cargo. He smiled in the specific way of someone who has been coached on how to behave at checkpoints. The state officer who approached the window was not looking for a fight. She was looking at a man in a gray van on an interstate at 7:19 a.m. and running the assessment that people in her job run automatically. She asked him to step out of the vehicle. He asked why. She said it was standard for the inspection category, which was a construction, but it was a legally supportable one, and Alt did not know enough about the specific parameters to challenge it with confidence, and his hesitation lasted half a second too long. He stepped out. The drive was in the center console, inside a foam-lined case that had been designed to look like a portable hard drive for commercial media storage. It was good work. It would have been convincing to anyone who wasn't specifically looking for it and didn't know what the case dimensions corresponded to. The federal officer who opened the console was specifically looking for it. She photographed it in place. She logged it. She sealed it with an evidence tag at 7:23 a.m. The signal on Reyes's receiver went from moving to stationary. Nora watched the dot stop. She stood in the imaging corridor at Varden Point with the receiver unit in her hands and the Colorado morning coming through the window at the end of the hall, and she felt the dot stop, and she said nothing. And the thing that moved through her chest in that moment was not triumph. It was something quieter. The specific settling of something that has been held in suspension for a very long time finally finding its place. The chain of custody on the drive was established within 2 hours. Federal agents, not the field office that had been handling adjacent investigations, but a separate unit with no institutional connection to the channels Boyle had access to, took custody at the checkpoint and transported it directly to a secure facility in Denver that Reyes designated. The biometric authentication was performed by Teal at 11:40 a.m., 47 hours and 12 minutes before the encryption would have wiped. He sat in a secured room in the Varden Point Medical Unit with a federal agent present and a camera recording and his left arm in a support brace, and he placed his thumb on the reader and looked into the retinal scanner, and the drive unlocked. The files inside were extensive. 4 years of documentation, contracts, payment records, routing instructions, communications between Boyle and 12 separate individuals across 4 institutional layers, including 3 federal employees, 2 military officers, one of whom was Colonel Whitmer, and Petra Vane's full record of fabricated identity construction going back 26 months. It also contained, in a subfolder that had been assembled by Teal's inside contact before that contact had disappeared from the contractor's payroll under circumstances that the federal investigators immediately flagged for a separate inquiry, a complete record of the supply chain deliveries and their deviations from specification. 31 cases. Then 34. Then, as the investigators worked through the documentation over the following days, 38 instances where equipment or medication had failed at a critical moment in a combat or operational medical context. Some had been attributed to environmental factors. Some had been marked as training accidents. Some were on files that had been closed under pressure from the same institutional layer that Whitmer had operated in. 38 people. Some of them had survived what they'd been through, with lasting effects. Some had not. Teal had known the number was large. He had not known it was that large. He sat in the medical unit after the authentication and looked at the wall for a while, and Finch, who had stayed past the end of her shift because she hadn't felt like leaving, brought him water and didn't say anything, which was exactly the right thing to do. The arrests happened across 4 days because the federal investigators were not going to move faster than the evidence supported, and because moving too fast on a network, this layered meant losing the upper connections before you had them secured. Boyle was arrested on the second day, in a hotel room in a city he had traveled to the previous morning on a ticket purchased under a secondary identity that Petra Vane had built for him 18 months earlier. The identity was good. The ticket purchase was clean, but the phone he had used to coordinate the previous night's operations had pinged a tower 12 miles from the hotel, and federal investigators had been sitting on that tower data since 6 a.m. of the first day. He came to the door in a hotel bathrobe. When he saw the agents, he looked at them for a long moment and then stepped back from the door and said, "I want my attorney." They told him he could call from custody. He went without incident, which was the action of a man who had long ago made a calculation about the circumstances under which it would and wouldn't be useful to resist, and had concluded that this was not one of those circumstances. It was a cold calculation, and it was correct, and it was also the most revealing thing about him. that even at the moment of his arrest, he was still running the numbers. Whitmer was arrested on the third day at his home in Virginia. He cried, which surprised the arresting agents, and then asked whether cooperating would help his situation, which did not surprise them. Petra Vane was arrested on the fourth day. She had not attempted to run, which the federal investigators found initially puzzling, and then, when they reviewed her financial records and found that she had been transferring money to a family member's account for the previous 6 weeks in amounts designed to stay below reporting thresholds, understood completely. She had been preparing for the possibility of arrest for a month and a half, which meant she had known, or suspected, that the architecture was beginning to fracture. Alt cooperated immediately in exchange for a conversation about his sentence. Strauss, through her attorney, confirmed that she would provide a full accounting of her activities at Varden Point in exchange for prosecutorial consideration, and the federal prosecutor's office, having reviewed what she was likely to provide against what they already had, agreed to the conversation. The network, piece by piece, came apart. Harwick's situation developed on a separate but parallel track. The phone call he had made at 1:22 a.m. from the parking lot of Meridian Valley Medical Center was documented by tower data and confirmed by the recipient's eventual cooperation. The content of the call, which Boyle's network had recorded as a matter of operational protocol, was recovered from a server that the federal investigators accessed in the second week of the investigation. In it, Harwick gave Boyle's operative the floor number, the surgical suite, and the information that Nightfall was inside the building. He also gave them the information that the general who had arrived was Warren Cole, which he had found out by asking a hospital security guard, which the guard later confirmed. The call lasted 4 minutes and 11 seconds, and in it Harwick said enough to constitute coordination with an active federal criminal enterprise, obstruction of a federal investigation, and disclosure of information that he had no authorization to possess or transmit. He was suspended from the Creston Police Department on the morning after the arrest began, pending investigation, by a chief of police who had known Harwick for 16 years, and who made the call from his office at 7 a.m. while looking at a summary document that a federal agent had walked in and placed on his desk 40 minutes earlier. Harwick's attorney argued that his client had not known the full nature of Boyle's network, which was true in the specific sense that Harwick had not known the details of the supply chain fraud or the 38 cases or the fabricated identities. He had known that Boyle existed. He had known that Boyle was not a person whose number you called from a legitimate context. He had known this for years, and had continued to maintain the relationship because the relationship had been useful to him in ways that he had convinced himself were minor and peripheral, and not the kind of thing that became a federal matter. He had been wrong about that. He was charged with 4 counts, the most serious of which carried a potential sentence that his attorney immediately began working to negotiate downward. The negotiation was not successful in the way Harwick had hoped. The federal prosecutor was not interested in Harwick's cooperation as much as Harwick's attorney had expected, because by the time Harwick was formally charged, the investigators already had most of what Harwick could provide from other sources. He was, in the prosecutor's privately stated assessment, a useful piece of evidence but not a particularly useful witness, which was a distinction that his attorney understood completely and found deeply inconvenient. The body camera footage from the night of Teal's arrival at Meridian Valley had been preserved as part of the federal investigation's evidence collection. It showed Harwick's conduct in the trauma bay. It showed him physically blocking a nurse's access to a patient in active hemodynamic compromise. It showed him speaking to Dr. Philip Sato in a manner that constituted clear, undue influence on a medical professional's clinical decisions. It showed him using language and authority he did not legally possess in a medical context to cause the removal of a qualified professional from a patient's care. The footage was not released publicly during the investigation. It was released afterward as part of the public court record, and it traveled in the specific way that footage travels, when it shows something that a large number of people immediately recognize as wrong. People watched it. Then they watched it again. Quotes. Nora was not watching it. She had seen the original event. She didn't need to watch a recording of it. She was at Meridian Valley Medical Center on a Tuesday morning 3 weeks after that night, standing in the parking lot in the same spot where she had sat in her car and read the text from Cole's number, watching the mountains that were visible now because it was daylight and the sky had decided to be clear. She had been asked to come in. Not for a shift. Her suspension had been lifted within 72 hours of the first federal arrests. with a letter from the hospital's chief of staff that was formal and correct and contained an apology that was genuine enough, but arrived in the register of an institution protecting itself rather than a person acknowledging what they'd done. She had read the letter once and put it in a drawer. The request to come in today was different. It came from Dr. Renata Kwan, not administration, and Kwan had called her directly on her personal number and said, "There are people who want to see you. I think you should come." She had come. Inside, the lobby had the same quality it always had at 9 a.m. The particular mid-morning calm of a place that has already handled its first wave of the day and is managing its breath before the next one. Frisco at the security desk looked up when she came through the doors and gave her the specific look of someone who had watched something happen that he couldn't quite categorize but that he understood had mattered. "Morning, Nora," he said. "Morning, Frisco." She went up. The conference room on the third floor had 12 people in it. Kwan, Sato, who was sitting near the window, and had the demeanor of a man who had been doing a quiet but sustained accounting of his own behavior for 3 weeks. Deborah Holt, who looked directly at Nora when she came in, and then looked at the table and then looked back up and kept her eyes there, which was its own kind of reckoning. 3 nurses she had worked alongside for years, 2 hospital administrators, and in the seats along the far wall, 2 people in civilian clothes who had federal identification that they had already shown to the room. And Cole, standing near the door, in uniform, who nodded at her when she entered in the way that people nod when they mean something more than the gesture, but don't have a better tool for it. The administrator who ran the meeting was not Marcus Graham. Graham had tendered his resignation 8 days ago, citing personal reasons, in a letter that nobody had contested because contesting it would have required a conversation about the night of Teal's arrival that the board had not been interested in having publicly. The administrator running the meeting was his interim replacement, a woman named Doris Haig, who had come from the Regional Health System's central office and who had the manner of someone who had read the full file and was not interested in minimizing what it contained. Haig said, "We're here today to formally acknowledge the events of November 14th and to put on record the hospital's position regarding the conduct of its staff during the admission of Sergeant First Class Marcus Teal." She read from a prepared statement. It was specific. It used the words clinical judgment and inappropriate interference and failure to support a qualified professional. And it did not hedge those phrases or qualify them with institutional language designed to soften them into something more comfortable. When she finished reading, she looked at Nora. "On behalf of Meridian Valley Medical Center," Haig said, "I want to say clearly and for the record, you were right. From the moment that patient came through the doors, your clinical assessment was correct. Your interventions were appropriate, and the actions taken against you that night were wrong. We failed you. We failed the patient, and we are sorry." The room was quiet. Nora looked at Haig. She looked at Sato, who was looking at his hands. She looked at Deborah Holt, who was still holding her gaze, and whose expression contained something complicated and human that was probably the closest Deborah had ever come to saying out loud that she had made a decision she wished she could unmake. Nora said, "Thank you." It wasn't a small thing to say. It wasn't a large thing either. It was exactly what the moment called for and nothing more. Because some moments don't need embellishment. They need acknowledgement, and acknowledgement was what she gave. Afterward, one of the federal agents spoke. She described, in terms that had been cleared for the room's clearance level, the broader context of what the investigation had uncovered. Not the full scope, that was still in active legal process, but enough that the medical professionals in the room understood that the patient they had nearly lost on the night of November 14th had been carrying information that had resulted in the arrest of 12 people, the exposure of a supply chain fraud that had affected military personnel across 4 years of operations, and the initiation of a separate review into 38 cases of equipment and medication failure that the relevant military branches were now examining with the specific institutional urgency of organizations that have discovered something that should have been caught earlier and was not. Sato listened to this without speaking. He was a good doctor. He was also a man who had, on a specific night, made a specific decision that had nearly cost a patient his life and had cost his colleague her dignity, and he was sitting with both of those things in a way that had no resolution except time and the quality of his choices going forward. After the federal agent finished, Sato looked at Nora across the room. "I'm sorry," he said. Not to the room, to her. She looked at him. "I know," she said. It wasn't absolution. It wasn't the closing of a door. It was two professionals in a room that had seen something difficult, and it was the only kind of thing that was actually honest to say. The formal recognition came 6 weeks later, in two separate ceremonies that Nora had not requested and could not entirely avoid. The first was a civilian commendation from the Department of Health and Human Services, presented at a ceremony in Denver that she attended in the same clothes she wore to work because she had not bought anything specific for it and was not going to start. The commendation recognized her medical interventions during the night of November 14th and her role in a sequence of events that had materially contributed to a significant federal investigation. The language was careful and formal and did not say everything, because formal commendations never do, but it said enough. She shook the presenting official's hand. She accepted the certificate. She thanked the room in 4 sentences that were genuine and sufficient. The second ceremony was military and smaller and happened at Varden Point on a gray December morning with a dozen people present and no cameras, which was how Nora had asked for it and how Cole had arranged it. The medal was a military decoration, not classified but not publicized, because the work it recognized had occurred in contexts that remained sensitive even 6 years later. Cole pinned it himself. His face had the expression of a man who is doing something he considers overdue and is aware that the awareness of it being overdue is itself worth something. "For valor," he said, which was the formula. And then, outside the formula, and for showing up when it mattered, both times. She looked at him. "Don't make it more than it was," she said. "I'm not," he said. "I'm making it exactly what it was." Teal was in the room. He was standing, which his surgeon had cleared 3 days earlier, and he was standing with the particular upright attention of a person who has been in enough formal military moments to know when to be still, and when the stillness itself is the thing that's called for. His left arm was in a support brace that would come off in another 2 weeks. His face had color in it again. After the ceremony, he found her in the corridor. "What are you going to do?" he asked. She thought about it honestly, which was how she tried to think about most things. "Go back to work," she said. "Here?" "Meridian Valley. Night shift." She looked at the window at the end of the corridor, the same window she had looked through on the night of Teal's arrival, except that it was day now, and she could see the mountains clearly. "There's a defibrillator on the second floor that still needs its battery replaced. I've submitted the request 5 times. Teal looked at her. His mouth did the thing it had done in the transport, the ghost of something. "That's your plan," he said, "after all of this." "The patients on my shift need someone who shows up and pays attention," she said. "That's not a small thing." "No," he said, "it's not." They stood in the corridor for a moment. Outside, the December sky was doing what December skies in Colorado do, heavy and gray and indifferent, but with a quality of light underneath it that suggested something eventually. "They offered me a position," she said. "Cole did. Training role, curriculum development for forward medical teams." "Are you going to take it?" "Part-time." She picked up the jacket she'd hung on the wall. "Night shift is not negotiable." He almost laughed. Almost. "Nightfall on the night shift. I stopped being Nightfall a long time ago." "You sure about that?" She looked at him, at the brace on his arm, at the color in his face that hadn't been there when she first saw him bleeding on a gurney in a city that hadn't been expecting any of this to happen. "Go rest," she said. "Actually rest. Strauss's compound cleared your system, but that doesn't mean you're invincible." "I never thought I was invincible." "You thought you were close enough." She moved toward the exit. "You're not. None of us are. Rest." She went out. The sentencing for Boyle happened in February, in a federal court in Denver, and Nora was not present for it because she was working. She read the verdict summary on her break. Standing in the break room at Meridian Valley with a cup of coffee that had gone lukewarm, in the specific quiet of 3 a.m. when the hospital has settled into its deep rhythm and the corridors are mostly still. Boyle, convicted on 14 counts, sentenced to 22 years, the judge's statement was specific about the 38 cases and about the fact that the fraud had not been a matter of negligence or corner-cutting, but of deliberate, sustained calculation over a period of years, and that the lives affected by it were not abstractions in a financial ledger, but human beings who had trusted that the systems built to support them were functioning as described. Whitmer. 9 years, cooperation credit applied. Petra Vane, 7 years, cooperation credit applied, with the observation from the judge that her level of technical sophistication and the duration of her participation placed her well above the category of minor actor, regardless of her cooperation. Alt, 4 years. Strauss, 6 years, cooperation agreement honored. Her testimony had been, in the prosecutor's assessment, the piece that had most clearly documented the internal communication structure between Boyle and the people he had positioned within institutions. The how of it, not just the what. She had known that structure intimately because she had been inside it for 3 years, recruited during a period of financial difficulty that she had not disclosed to her commanding officers and that Boyle's network had identified and used. Harwick, convicted on 3 counts, sentenced to 4 years, 2 suspended. He would serve 2 years and lose his pension and his certification permanently. The judge noted that the night of November 14th represented a specific and significant failure of judgment and authority that had occurred in a context where a patient's life was in immediate danger, and that the consequences of that failure had been prevented not by any institutional safeguard, but by the individual professional who had been wrongfully removed from the situation. Nora read that line twice. She put her phone in her pocket. She finished her coffee. Down the hall, one of the monitors at the nurse's station gave its alert tone. Not urgent, just a routine flag. And she set the cup down and went back to work. There is a specific thing that happens to people who spend years being told, in various ways and with various degrees of subtlety, that they are less than what they actually are. Some of them start to believe it, which is the intended effect. Some of them develop a performance of what they're supposed to be, which is a different kind of damage. And some of them, not because they are stronger or better, but because something in the particular architecture of their experience produces this outcome. Learn to carry what they know about themselves in a place that is entirely their own. Quiet. Separate from what other people say about it. Not hidden exactly, but held close, because the alternative is exhausting. And because the work still needs doing regardless of whether anyone around you understands who is doing it. Nora Voss had been doing that for a long time. She had done it in a tent in conditions that would have been described, in any honest account, as extraordinarily difficult, with equipment that was sometimes inadequate, and people who were counting on her in ways that had nothing abstract about them. She had done it when she left that work and came to a mid-sized city in Colorado and took the night shift at a hospital that needed someone capable and never looked very hard at what it had. She had done it when a lieutenant put his forearm across her chest and told her she was just a nurse, and when an administrator chose to believe the lieutenant because that was the easier calculation, and when security walked her out of a building she had worked in for 3 years. She had done it because the work needed doing, because a man was bleeding on a table, because the alternative to doing the work, the alternative of not doing it, of letting the moment pass, of deciding that the person in authority was right and she was wrong, was not actually an alternative, not for her, not for someone who had seen what she had seen and knew what she knew. That is not a heroic statement. It is a human one. The heroic version would have her doing it for a grand reason, for justice or legacy or the idea of herself that she wanted to be. The human version is simpler and more specific. She did it because the man was bleeding and she knew how to help, and so she helped, and all the rest of it. The consequences, the public record, the commendations and the ceremonies, and the eventual collapse of a network that had operated in the shadows of legitimate institutions for years. All of that followed from that one unremarkable, essential choice. Most of the choices that matter look like that, from the inside. Ordinary, immediate, made without full knowledge of where they lead. What you carry into those moments is everything. Your experience, your training, your failures, and the things you learned from them. The years of being dismissed and the steadiness you developed in response to it. The quiet knowledge of who you are that you maintain even when the room has decided something different about you. You carry all of that, and when the moment arrives, it's available. Nora Voss was working the night shift at Meridian Valley Medical Center on a Thursday in March when she heard the code called from the second floor. She was already moving before the overhead finished. She went through the stairwell door and up the stairs at a pace that wasted nothing, and she came through the second floor door and into the corridor, and she passed the defibrillator in its wall bracket, the one she had submitted the maintenance request for 6 times, the 7th of which had finally been processed 2 days ago, with a new battery installed and a green indicator light glowing. and she went into the room where the patient needed her. She was exactly who the room needed. She had always been. That was what the people who dismissed her had never understood, and what she had never stopped knowing, that being underestimated doesn't diminish what you carry. It only means the people around you are unprepared for what happens when the moment arrives, and you're exactly enough for it. She was exactly enough. She went to work.